All right. So today the topic is going to be smart actions for mental health. My name is Lee Bridgman. I am a program assistant with University of Maryland Extension over on the Eastern Shore of Maryland in Queen Anne's County. We'll be using the chat pod today for questions. So if you have a question, please type in the chat pod to everyone, and we will get to the questions as we go through the presentation. Again, I want to remind you recording. Just so you know, you'll get an email from Shannon with the recording that you can feel free to share with anyone you would like to. I'll share a couple of links to future webinars and how to register for them. And now I would like to turn the presentation over to Dr. Jesse Ketterman to talk about smart actions for mental health.
Thank you, Leanne. And yes, my name is Jesse Ketterman. I'm with Extension on the Western counties of Maryland, specifically Allegheny, Washington, and Garrett counties. And my focus is financial literacy and health insurance literacy. And so today we're definitely tilted more on the health insurance literacy side, and more specifically on the health insurance literacy side are smart actions for mental health. And so I do have a little survey that I asked participants to complete, and I'm going to post that in the chat box. And you're going to notice when you go to that survey, at the end of the first page, it says minimize, and we'll come back to it at the end because we're going to ask you the same questions at the end. So if you could take a minute to fill out this survey, I would appreciate it. And it is posted in the chat box now. And again, just complete that first page and then minimize that window because we will come back to it again later. And when you finish the survey, just make a little note in the chat box, say ready, done, whatever you want to say, and then we'll kind of move forward from there. And as Leanne mentioned, thank you for joining us. As people are completing the survey, we'll go ahead and kind of tell you what we're going to cover today. So as you can see, this session will help you understand the range of mental health care services. So we're going to talk about the range of services today. We're going to talk about why it's important to seek treatment for mental health care challenges. And we're going to talk about how you can use health insurance to pay for mental health care and manage expenses. So that's the what, why, and the how of what we're going to try to do today. So we like to start these presentations with, why. Smart use helps you manage your health and money, but why is it important to manage your mental health? And one of the things we know about managing your health is that the healthier you can stay, the more likely you are to be able to attend work and attend school. And the longer you are not well, the more time you miss work, and the likelihood of you missing school are greater. So we want to get people to think healthy and be healthy. Health insurance helps you prevent and manage healthcare challenges. And so, we've all experienced different challenges when it comes to mental health. And if I had to ask people, I did this webinar actually earlier this morning for another group, and I asked the question, do you know someone that experienced a mental health challenge? And everyone raised their hand. So, we know that people deal with a variety of mental health challenges at some form or some level or another. And so that health insurance helps you prevent and manage those healthcare challenges when you do experience them. And the third thing is to seek help early and reduce recovery time and expense. So again, we go back to, if we can get healthy and stay healthy, it shortens recovery time. It's like, again, addressing things early makes recovery faster. And because you're going to need less care, it's going to be less expensive. And the last item is the secondary effects. And so again, when you have secondary effects, such as how it impacts our relationship with others, right? There are a lot of secondary effects that go along when you're dealing with mental health challenges. And so the sooner you can address those mental health challenges, the sooner, the more you can avoid those secondary effects. So again, those are the 4 reasons that I have why it's important for you to manage your health, your mental health. Important words to know. Now, one of the things that our team has done around health insurance literacy is focused on the terminology. A lot of people are confused by health insurance terms. And so we're going to do kind of 2 things today to help work with terms. At the end of our presentation, I'm going to share with you our website, and there's a whole list of terms and definitions that you can look at on our consumer tab. But right now we're going to play this game. So let me switch over screens here. Give me a second. All right. So what we want to do now is match the term with the definition. And so I could ask everyone to go to this link, but we're just going to kind of do this together. So over here, medical doctor who has specialized in the diagnosis and treatment of psychological disorders. Which of these terms do you think that goes with? And you can type that in the chat box. But a medical doctor who has specialized in the diagnosis and treatment of psychological disorders. Would that be psychiatrist? All right, we'll put those 2 together and see what happens. Yep, there we go. Good, good. All right, let's go over here to caused by assigning the wrong billing code to a service, which may result in improper reimbursement. Yeah, well, that's right above there, coding error. Let me drop that down. Oops. Good. A one-to-one relationship involving a trained counselor where the focus of the relationship is on some aspect of the client's adjustment, development, and decision-making. So the one-on-one relationship. Looking up in my chat, individual counseling. We got that one. All right. The amount you must pay before you begin receiving any benefits from your health insurance company. The amount you pay before you begin receiving benefits. Deductible. Okay. Down here at the bottom, a document that describes in detail the health care benefits covered by the health plan. A document that describes in detail the health care benefits covered by the health care plan. Evidence of coverage. Correct. And our last one, of course, will be a package of benefits set by the Secretary of Health and Human Services, and insurers will be required to offer under the exchange, and that would be the essential health benefit. All right, so that's just kind of a couple terms for, and again, we're going to kind of have some other terms as we go along as well. We'll do as a multiple choice. So here on the screen, you can see a continuum of mental health care services, and we're going from least intensive to most intensive. And we're talking about least intensive, we're looking at no office visits are required. And then when we talk about most intensive, it requires an extended time at a facility. And so we start with health coaching. And one way to think of health coaching is you think about your time in high school. If you were involved in a sports team and you have a coach, and that coach is there to motivate you and support you and kind of move you in the right direction, you know, a health coach is going to do something similar there in terms of health coaching. right? They're going to be working with you, giving you support, guidance, some direction. Then we have peer support, and that may be a colleague who has experienced or who has experienced something similar, and so they can relate to what you're going through, and so that's kind of a peer support service. Then you get into doctor prescribed medication and blood work. So that may be something that you do with your primary care physician. There's other types of doctors as well. We're going to talk about them. But, that's kind of working your way up, working individually with a doctor. Then you get into group therapy, and usually group therapy includes a number of people that are experiencing the same similar mental health issues that you are. And there is a facilitator that, again, is providing a support group to help people go through those mental health challenges. Then you kind of get into individual therapy, which is one-on-one with a professional. Family or couples, again, you're working with a professional, but you're looking at it more from, your significant other or your significant other and your children, or even it could be close friends as well. Then you get into intensive outpatient programs, and then in an outpatient program, at the end of the day, you're going home. You might be there for several hours, but then at the end of the day, you go home. Then you get into the inpatient and hospitalization, where you're under care for overnight, so over 24 hours. And the time of inpatient hospitalization is going to vary depending upon the particular situation. So there are a spectrum of providers that provide different levels of care. And so, you have your medical doctors, and your medical doctors may include psychiatrists or other doctors. And then you have advanced practitioners. When you think about advanced practitioners, you're thinking about nurse practitioners or physician's assistants. And there are individuals within those nurse practitioners and physician's assistants that specialize in mental health issues. You have psychologists who are mental health professionals with advanced training, and they can diagnose and treat mental health conditions. Social workers, and there's different levels of social workers. You have bachelor social workers that are there providing support in terms of what resources are available. But as you get into upper levels of social work, they have the ability to treat and diagnose as well. Counselors are trained to give guidance on personal, social, and psychological problems, usually more on a short-term basis. Then you have crisis support specialists. And again, when you think of crisis, it's an immediate response. It's short-term. And so they're trained to give guidance and support in a crisis. And that can be done in face, online, or over the phone. And you have substance abuse professionals that are specifically trained on a specific substance abuse issue. And then you have certified peer specialists, which are individuals who have lived experience with a mental health challenge and have been trained to assist others. So that's kind of your spectrum of providers. So let's go back to some important words to know. And I pulled this from the National Alliance on Mental Health or Mental Illness. And so choose A, B, C, or D. Which one is a clergy member with training in clinical pastoral education? They are trained to diagnose and provide counseling. Pastoral counselors can have equivalents to a doctorate in counseling. All right, so we had someone jump in with the B, and that is correct. That's B. All right. So now we're going to get into reviewing a couple actions that you should take to support your mental health. And so from a health insurance perspective, and so one of the first mental smart action on mental health is know what your health insurance policy covers for mental health services. And so when you're thinking about why that is important, we're looking at knowing what services are covered in the benefits. And so again, what is covered in the sense of your treatment plan, and what is covered in terms of if you have an emergency and have to go to the emergency room or an inpatient facility. So it's important to know what is covered by your insurance policy. It also is important because you can understand the costs that go along with it, right? And so knowing what is provided is going to tell you information about your copay and your deductible. And you also need to know what are your in-network providers and facilities. And so in-network providers and facilities are going to typically charge less than out-of-network, and we're going to talk about that in a little bit. And then you also want to know what the process is for disputing an error. So we know that depending upon the study, billing errors can occur anywhere between 20 to 80% of the time. And then, the studies vary with that. And so knowing what is covered and what the dispute process is an important thing, an important action for you to know. And so knowing where you go to know what your health insurance policy covers, you're looking at your evidence of coverage document. And your evidence of coverage document is kind of like the agreement between you and the insurance company. It details what they cover and what your responsibilities are when it comes to your health insurance. And so now I want you to think about, we're going to play a short video, and we're talking about therapy and why it is more than just for severe mental illness.
So I want to speak to you a little bit about when it might be appropriate to go see a therapist. I think this is a question that a lot of people are confused about and have some misconceptions about, and hopefully I can clear some of those up for you. My name is Dr. Sonia, and I'm a licensed clinical psychologist with over 10 years of experience. And I've worked with people of all ages on smaller issues and bigger issues. And I think that's one of the most important points, is that sometimes we all need a little bit of help in life. And it doesn't have to be that your whole world is falling down before you seek the help of somebody for that outside clinical professional perspective. So I recently had the pleasure of working with somebody who graduated from therapy. They did quite well, and they were talking about a friend of theirs who had also had a recent struggle with a life issue. And that friend was saying, I don't know if I'm sick enough to see a therapist. And I think this is one of the most common misconceptions that people have about therapy, is that you have to have a serious problem or a really big problem in order to seek help. And the truth is, licensed counselors can help you with a variety of things that happen in life. Sometimes some of the things that we perceive as positive are still stressful. For example, getting married for a lot of people is the happiest thing that happens to them. Preparing for a marriage, however, can be one of the most stressful things. So seeking help for things like that can be equally important as seeking help for typical mental health conditions that people think of, like anxiety and depression. As a licensed counselor, and more importantly as a human, I've always wondered why we wait until the last possible moment to seek help for the things that we're struggling with. And I really like this idea that's beginning to emerge about emotional wellness. We go to our primary care doc every year and get a physical and a checkup just to make sure that everything's okay. And I think that we really need to start to have the same mentality towards mental health and mental health issues. Why not be proactive and deal with the problems that are arising before they get to a crisis point? Why not check in with a licensed professional to make sure that everything is on the right track, or to maximize your potential, or to evaluate your strengths, versus waiting until something's really going wrong? A great place to start exploring.
So, I'm not necessarily, well, I'm definitely not endorsing BetterHelp, but I think the video is a good example of the importance of thinking that mental health issues, seeking therapy or support is important. And again, as they mentioned, like the stress associated with planning a wedding, right? That's not a severe mental illness, but having the appropriate support can help you get through that challenging time of all the stress that goes along with that. So now we're back into the important words. And so which of these individuals can provide assessment, diagnosis, and therapy for mental health conditions or substance abuse disorders? In some states, they are also qualified to prescribe and monitor medications. And again, there's kind of like, there's one right answer, but some have the ability to do this as well. Who wants to take a guess here? D, not really what we're looking for. So, again, when we talk about psychiatric or mental health nurse practitioners, they have specific training for those types of things. And again, depending upon the state, they have the ability to prescribe and monitor medications, but their specialty is the assessment and diagnosis and therapy for mental health conditions. But I can see where psychiatrist might be an answer. Again, I was using the definition from the National Alliance on Mental Illness. So another smart action to take is to make sure that you seek treatment early. The video kind of reinforced that. And we talk about why it's important. It can be difficult to get into providers. I'm in Western Maryland, and I know that there's a limited number of providers. I know several of you are from the Eastern Shore. And so, again, there can be long wait times to get into a provider. So it's important to seek treatment early. So if things do progress, again, you're already ready to and have your appointment set up. Seeking treatment early also helps prevent things from getting worse. And then again, because you're addressing things early on, it can reduce your overall cost because you'll need less treatment, less therapy, because you've addressed the issue early. And of course, it helps you stay healthy. Next smart action is to choose in-network providers. Important to choose in-network providers because it saves you money. And when I'm talking about in-network providers, your insurance company contracts with certain providers, and part of that contract includes what the health insurance is going to pay in terms of cost. And so because they're in network, that's going to save you money. And where do you find out who is in network? You can look at the insurance company. They're going to have that information. So a lot of times, if you look at your health insurance card, you can call the information number on the card. You can also go on a company's website, the health insurance company's website, and look that information up. And the other thing you can do is ask the provider. Most, provider is going to know whether or not they're in network with your health insurance plan. So in some cases, you can't get into an in-network provider, or you are going to need an out-of-network provider. Maybe it's someone that has been recommended and it's something you want to go to. So some things to think about when you are thinking about an out-of-network provider is, how much does your plan cover for out-of-network providers? And so making sure you're reviewing your evidence of coverage just to know how much it's going to cost you when you go to an out-of-network provider. And then do you have the money to cover the expenses while you wait for reimbursement? So in some cases, you have to pay the provider, and then you have to file a claim with the insurance company to get reimbursed. And so you need to make sure that you have that money for those expenses. And then, another thing to consider is, sometimes you'll go to an out-of-network provider because they're more qualified to treat the issue that you're dealing with. And there may be a shorter wait time. And so there are cases when you will go to an out-of-network provider because it better fits your particular situation. Back to important words to know. So who can prescribe medication, but you might consider visiting someone who specializes in mental health care. So this person can provide medication, but they may not be the best person to go to if you're dealing with a mental health issue. All right, I think Leanne is right on it there. C, a primary care provider or physician. Again, they can prescribe medication. They're generalists, right? And so when you're dealing with a mental health care issue, you might start there, but you want to get someone who has specialized training on the issues that you're dealing with. So the primary physician may be a starting point, but you may want to consider someone who specializes in mental health care. So explanation of benefits. You do want to review that explanation of benefits. That's the document you get at the end of each month, or you get it monthly. It kind of reviews all the how you've used insurance over the past month. And so it's going to have, on this date, you went to this provider, this is what the insurance coverage, this is what they billed, this is how much you might be responsible for. And so it's a good place to kind of check to make sure that the billing information is correct. So things you should look at is the date of service, the provider's name, what type of treatment was provided. And then the other thing, reviewing that explanation of benefits is important because it prevents, it can be a form of preventing medical ID theft. So if you're reviewing your explanation of benefits, you can look at that and say, oh, wait a minute, somebody used this service on this date, but it wasn't anyone, it wasn't me. Much the same way that you might check your credit card statement and say, wait a minute, I didn't use my credit card on this date. Maybe somebody stole my credit card number. It's the same thing in terms of preventing medical ID theft. Next important words to know. This person provides case management, inpatient discharge planning services, placement services, and other medical services to support healthy living. So would that be a social worker, a pastoral counselor, a primary care physician, or certified peer specialist? And we're going to go with a social worker, right? The social worker, A. And if you recall earlier, I said, there's different types of social work degrees. Here we're talking about that BA or Bachelor of Arts or Bachelor of Science level social worker. When you move up into the master's level, they do have some additional things they can do, such as diagnose and treat. So we're talking about that bachelor's level social worker. So what are some alternative ways to cover your cost? And so with your insurance plan, you might have a health savings account or a flexible spending account. Those are ways to offset some of those initial expenses because it's money that you have set aside for that particular purpose. You may use free services. So in your area, there may be support groups. Example might be Alcoholics Anonymous, as a support group. There's all kinds of support groups in your area. And so you might utilize support groups. The other would be employee assistance programs. And so employee assistance programs offered through your employer usually provide a short-term service to help address certain issues or to work through certain issues. And there are also providers that offer services based on income. And so you'd have to search around in your area to see what providers do that, but it's kind of income-based services. And again, when you're using these alternative ways, it can help you get healthy and stay healthy. Next important word to know, specialists that have lived experience with a mental health condition or substance use disorder. They are often trained, certified, and prepared to assist with recovery by helping a person set goals and develop strengths. They provide support, mentoring, and guidance. And we already had our quick answer there with certified peer specialist, and that is correct, right? They have lived experience and they want to help others as they have been helped. Another smart action, make sure you have proof of insurance on you at all times. You should be carrying your insurance card with you now. Why is it important? It gives important information about your policy. It lists co-payments for medical services, has a phone number that you can call to ask questions. And where do you find it? On your health insurance card. And here's an example of your health insurance card. And you can see it's going to have your name, your member number, group number. And then in block 5 there, it has that copay aspect. 6 is that number. 4 is plan type. So again, make sure you carry your health insurance card with you at all times. So now we're going to review using a case study. And we're going to try to have a little fun with our Zoom session here. But before we do that, we're going to review what we talked about today, and then we're going to show a little narrative, and I'm going to want you to kind of underline those actions that we discussed today in this case study. So we want you to know what your health insurance policy covers for mental health services. We want you to seek treatment early, choose in-network providers, decide when out-of-network providers are appropriate, review the explanation of benefits, and look for alternative ways to cover cost, and carry that proof of insurance. And so I want you to look for these action items in this case study, and we're going to use a function called annotate to do that. So if you look on your menu, you're going to see an annotate button. If you click that, it's going to turn your cursor into a pencil, and you can write, or if you want to highlight, you can. So what I want you to do is I read this, I want you to underline the actions that we talked about today. So I want you to give you a minute, click on that annotate button. If you want to go to the side somewhere and test this out just to see what it looks like I am over here on the left, feel free to do that. And then I want you to underline aspects as we go through the case study. So clicking on that annotate button, and when you come onto the screen, I should see, there we go. I see Emma there. Matt. All right. Okay, let's get going then. A couple people are there. Recently, Bailey found out at work that the company was switching to a new health insurance company. After enrolling in the new plan, Bailey got the evidence covered and insurance card in the mail. Bailey looked through the evidence of coverage to figure out the cost of different types of mental health services. Any of those actions that we talked about? Did we just go through any of those actions? There we go. Evidence of coverage. Absolutely. There you go. Now you guys know what we're doing. All right. So you can just underline as I go. Bailey saw that outpatient services office visits with a mental health care provider would cost $15 for in-network providers. Yep. Outpatient office visits. Very good. In-network providers. Later in the year, Bailey lived through many stressful events. There was a death in the family, which strained Bailey's family relationships, and Bailey also received a negative work review. Bailey began noticing warning signs that challenges were becoming too much to manage with just support from friends and self-care. Bailey had trouble not thinking about stressful things, and she had a hard time sleeping. Bailey remembered that mental health care was a covered benefit in her workplace's health plan and decided to seek care. Yep, covered benefit, workplace health plan. Bailey called the insurance company to get a list of in-network providers. There we go. After calling providers, Bailey learned that the wait time to see any of them was over a month. Bailey was worried that waiting a month to see someone might let things get worse. Bailey began searching for out-of-network providers, but quickly realized that the costs were too high to cover without some prior planning. Bailey then called the HR department, human resources, at work to determine if there were any any other options. They informed Bailey that the workplace provided free employee assistance program and provided 3 counseling sessions at no cost. There's that employee assistance program. Yes, good job, Mac. Bailey realized that this would be enough to bridge the gap between now and the time when an in-network provider was available. The HR team also told Bailey that the workplace offered a health care savings account that Bailey could use to pay for out-of-network cost, and Bailey decided it would be smart to enroll in a health savings account during the next open enrollment period. So good job. I think you hit all of the key points that we talked about today. Now let me clear all of this before I move to my next screen. All right, and now I need to close my annotate. All right, now we're back. And so that kind of wraps things up today. If you could go back to that survey and fill that out, I'd appreciate it. Just the screen that you minimized earlier, open it back up, hit the next at the bottom of the screen, and that'll take you to the questions. And again, it's going to ask you the same questions. Again, it's all anonymous, so you don't have to worry about your responses being connected to you. We just want to see if people learn something out of our program today. I also mentioned our Insure website earlier, especially when we're talking about the health insurance terms, but we do have a lot of resources there, and that would be extension.umd.edu/insure. There's a consumer tab. We have a workbook there for selecting insurance. We have terms, how to choose a doctor, just lots of resources there. If you're trying to figure out what health insurance options there are out there, there's information about that as well, but it's a good website for you. There's my contact information. I'll also put that in the chat box. Feel free to text me any questions. And then 2 more slides. We have reliable resources. So there's our site. There's also a resource in Maryland called Maryland 211. And it talks about a variety. The site has a variety of human service needs, which include mental health referrals. And that would be, you can go to the website at 211md.org, or you can just dial 211 and someone will be able to assist you. There are some screening tools out there. You can look at Mental Health America and see the screening tool there. And then there's some resource there for frequently asked questions from Maryland Insurance Administration. And you'll get a copy of the PowerPoint, so you're going to have access to this. And my next slide is just acknowledging the team members who contributed to developing this PowerPoint. And that kind of wraps things up. I want to thank you for being a part of our session today. Smart Use Health Insurance, Smart Actions for Mental Health. And if you have any questions, feel free to put them in the chat box. I know my colleague Leanne has posted in the chat box more information about the next webinar. Is that correct, Leanne?
Yeah, I put a few links in there. I probably should have done them separately, but one is to the general webinar page, and the other one takes you to the Eventbrite for signing up for the webinars. I'm not sure if Amber still has a question. Hand was raised, so.
No,
there we
I'm good. I accidentally bumped it when I was trying to do the survey.
All right, thank you.
I have a question, and you might be, so if someone is thinking they want to go and find a provider, and I might have missed this, but how do you choose between, say, a licensed therapist and a psychiatrist? Should you consult your primary care physician? Or
Yeah, I think your primary care physician is going to kind of tell you based upon their experience what they feel would provide you the best service. Sometimes that also goes back to, when you talk to others, again, we all experience a variety of mental health issues. And sometimes people say, you know what, I recommend this person because they are good at what they do. And so I wouldn't necessarily rule that out in terms of selecting a provider as well.
thank you. Okay. All right. Any other questions? A few minutes. Looks like everyone's. All right. Well, thank you for joining us today, and thank you for the presentation. It was good information, great information. And I guess everyone have a good week and enjoy the rest of the summer.
Thank you.